First of all, I say from a big picture perspective, it's given us an idea of what the future vision can be and what the opportunities are. So certainly in terms of the interaction with our patients, the patient portal, how we can then use those records to undertake research and development. That's been the big sort of piece, if you like, around what the benefits can look like.
Well, it's actually quite empowering. And speaking to many clinicians myself, I find them to say that it's actually a positive change, and not having to wait for medical notes to come, for example, for a surgical theatre to start, or losing notes, even worse. All of that, we don't have to worry anymore because the information is all in the system. So I think that's a great benefit of having such an integrated EPR.
So I think there will be some big changes that happen going forward, but I do think most of it is happening beneath the surface as such, and the way that we can actually manage patients, the way that we can hopefully in the future manage the flow of our patients through the hospital and beds and all of those things actually should just mean that it just improves.
And what we are seeing is that our old system, because it was homegrown, it served people well on the day-to-day. However, it didn't have the capabilities that we talked about. It didn't have that integration. It didn't have the capability of the data collection, of population health management. So the capability of such complex EPR systems is the amount of data that it's in there. We can use them to not just do audits, clinical audits, but also raise research questions and engage people in research, which is what excites clinicians.
Really simple example was probably less thought of around our portering, and of course in their process for the last 20 years they've been picking up the paper record and they've been taking it with them with the patient to radiology. We have effectively the handhelds that the porters are able to use and were trained and signed up to use, and that was brilliant. First porter turns up to a patient to go to radiology and asks, where's the patient record? And you go, that is on our EPR.